We do have enough folks in the room to go ahead and get started with this morning's meeting. I did want to, throughout today's meeting, to share some video clips that I think are really good at messaging about the issues around homelessness and building support for solutions. And these messages come from the first one I'll play is a 30-second video clip. Each of the three that I will play during today's meeting is a 30-second video clip. And they come from the Housing Narrative Lab, which has been doing national research on how best to create messages that will persuade folks who are persuadable to support solutions to homelessness. So if you'll indulge me, I'll show this 30-second clip and we will get started with this morning's meeting. All right. And please let me know if there's any issues with the video or audio.
Some people see things simply, like homelessness is only a personal choice. And they say our government, who works for us, has no role in fixing it. But most of us know homelessness is not an American value, because no matter what we look like, every person deserves a safe, quality, and affordable place to live. And there are proven, evidence-based strategies for how we deliver, so everyone in our community has shelter.
So that is clip number one. I will put the link to the page where these video clips live and where information about the research lives. But let's go ahead and get started with this morning's meeting. So welcome everyone to this week's meeting of the Tacoma-Pierce County Coalition to End Homelessness. Rosemary, would you like to kick us off?
Thank you, Rob, and thanks for that message. I'm actually going to start with something that reinforces that a little bit. Any of us who's tried to raise funds for a cause we care about has thought about messaging. What will motivate new donors to support us and past donors to dig deeper? And I see the results of these messaging strategy meetings every day in the many pleas, excuse me, pleas for funds that arrive in the mail. Yesterday, one group included a message on the outside of the envelope, this time addressing me by name and in bold letters. And it said, "Rosemary, time may be running out." Well, it didn't make me want to open the envelope. My first reaction, based on my almost daily despair about us humans figuring things out peacefully, was not a passive sentence construction. "Time has run out" seemed more like it. Time has run out for doing things we've been doing in the same ways, from dependence on fossil fuels to ways of providing housing in our communities, and from expecting social service organizations to manage the human consequences of these ways of doing things. So we meet here together every week in this space to explore how we might act together in this time that has run out. Today, I ask us to honor everyone who's working at the edge of their energy in this work. Those supervising a staff that's too small, those on a team with too little time or too few resources to address the needs, those navigating conflicts that necessarily emerge when human suffering interacts with bureaucratic process. The honoring can take many forms. We don't often think about this, maybe some of you do, but it's hard sometimes when you're also at the edge of your own energy. We can thank one another for our efforts. We can breathe deeply and listen more carefully when our own energy is low, knowing that it's hard. We can accept and act on our own need to rest and reflect. I honor too the peoples who have worked for generations at the edge of their energy, acknowledging that we gather on the traditional homelands of the Puyallup tribe, who have lived on and stewarded these lands since the beginning of time and continue to do so today, even when time keeps running out. For many oppressed peoples, the claim that time has run out has described their experience of trauma and being on the edge for centuries. So as we act together in this time to address the essential need for home, we can remember the words of Lucille Clifton as she says, "In the inner city, or like we call it, home, We think a lot about Uptown and the silent nights and the houses straight as dead men and the pastel lights. And we hang on to our no place, happy to be alive and in the inner city, or like we call it, home. So welcome to all of you to our open table today, where we continue to connect with each other, learn from each other, and work to ensure that everyone has a home. So as we think about our day, those of you who may be new, just to remind you of how we work together here, we have the hand raise function for any time you want to be recognized. Keep yourself muted when you're not speaking. And if you're doing other things, take the video off for a while too. We encourage everyone to show your video once in a while so we can see your face if you have the capacity to do it, so we can recognize you and honor you too when we meet outside of this space. We also have a set of community norms, and I hope, Rob, you've put those in there. Usually you do every week. So pay attention to each other, take time, but also don't take too much time. Use the chat as a way to say more if you have more to say. Since we have right now almost 60 people here, remember that would not make very many minutes for each of us if we all talked once. So use the chat as a way to network. We save this, it's a resource and something we can go back to. It's available on our webpage. And so I think I'll stop with that, Rob, and turn it back to you.
Okay, and we do invite, have a couple of moments here to invite folks who are new to today's, to these meetings to introduce yourself. If you would like to say a word about, well, either if you're here for the first time or rejoining us after a period of being away, introduce yourself briefly, let us know what organization you represent, and we would love to welcome you. So use the raise hand function, wave your hand, or just speak up. I'd love to hear from you. The sound of silence. All right, so we are glad to be among friends here, working on the issues of homelessness. And so thank you everyone for being here. I will reiterate the one thing that Rosemary said about the chat. Please do use the chat as a resource. And I see that Christina, you got that message. So thank you for introducing yourself in the chat. All right, so let's get started with our first item that we do every week. And that is the This Week on the Streets segment. And what we ask of folks during this segment is, if you are doing outreach or observing changes on the streets among those who are living outdoors over the last week, please share your observations and any awareness that you have of needs that we may be able to address with the 60 plus of us who are gathered here together this morning. Please use the raise hand function and let me know you have something to add. It would be great to hear from everyone. And we will get started with Patricia has her hand up.
Yeah, I have a missing person alert, so I'd like to try to put that in chat. He's missing from Fife, so he's autistic, and I'll try to get the picture in chat. Thank you.
Thank you, Patricia. And others, one of the things I will say about context for this coming week in particular is that long-range forecasts for the next 10 days show the potential for warm weather, warm to hot weather again next week. So we're tracking that. You'll see if you go to the pchomeless.org website that I have updated the little highlighted message to talk about the fact that we're tracking potential temperatures over 85 next week, and that there may be a need to step up efforts to distribute water to folks who are currently living outdoors. So with that context, why don't we go to Monique? I see your hand up.
I just want to give a quick update on Fob Hope. So we've had a lot of growing pains there, learning about folks and their survival mode, how they operate and move through the day. But I will say we've gotten 10 folks housed. We have another group of folks who have HUD-VASH vouchers in hand, trying to find housing, which the VA has been extremely helpful. We've had a lot of providers come. MDC is now coming regularly. We have a medic that comes regularly. We are finding that there's a lot of drugs going on in the camp. We've had to kick a few people out due to that. And we know that it's going to be a time for them to learn how to act differently, right, as opposed to what they had been doing before. We have a couple that will be going to a methadone clinic on Monday, so they are trying to both get clean at the same time. And there's been a lot of shifting with management and security on the site. We have a new site manager, as I mentioned. Tammy Creeley will be running the site. I will be in Nevada. I can still be reached via email, telephone. You have questions, concerns, you can still contact me. I have every confidence in Tammy running the site, as well as she's got some assistance there with transportation and case management. But I feel good that everything is going to continue to run well. And we'll just keep growing. I have lots more to put in my lessons learned. So I will be adding more, Sally.
Great. Thanks, Monique. And it's good to see you, good to hear from you, and good to hear that you're going to be able to continue while you're in Nevada.
Yeah, thank you. And I will be on these calls every Friday because I know now more than ever, I've got to stay in the mix with you guys. So I'm back.
Awesome. Glad to have you.
Thanks.
Other folks with comments about what they're seeing on the streets. Sally?
So at 10th and L, which was a complex encampment where there's a lot of concern about criminal activity as well as unhoused people, you will remember that several weeks ago the unhoused people were swept. The criminal activity has remained, and it's blatant on the weekends. On Sunday, we couldn't even drive down L Street for the amount of people in the street with drugs and what looked to me like possibly prostitution as well. So part of the messaging we need to do is when you blame the encampment for the criminal activity and you move the unhoused people, you give the criminal activity free rein unless you go back and deal with that as well. So it makes me angry as a long-term resident of the Hilltop because the drug stuff has done so much damage in this neighborhood to everybody involved in it, even the people who think they're benefiting from it. So I just wanted to put that out there so people knew what one of the outcomes of that sweep.
Thanks, Sally, and sorry to hear that you're going through that in your neighborhood. Richard, your hand's up.
Just commenting, 2 or 3 of the significant encampments continue to grow. General Plastics at 40th and South Fife, South Tacoma Way, and the one at Sprague on South Tacoma Way and Center Street under the freeway structure. And then the one other point I just wanted to mention is that the citizens concerned with the 40th and South Fife encampment are meeting next, I believe it's Thursday, it's the 18th, 7:30 a.m. at Marlene's to meet with police to express their concerns and frustrations. So that's coming up next week. I hope to drop in on that just to listen to the conversation.
Thank you, Richard. And I see Caleb on the screen. Caleb, is NCS going to be at that meeting next week?
I'm sorry, which meeting, Rob?
So it'd been reported by Como TV that there was going to be a meeting with businesses and maybe the CLOs for the area down by South 38th and Pine.
Is that at Marlene's?
Yeah.
I think Allison is planning on being there.
Okay. If
Yeah.
you had a chance, could you confirm the meeting details, just the time? We know it's at Marlene's, but
Yeah.
the only confirmation that we'd had for that meeting was what we saw in the Como piece. So,
Okay, let me reach out and let's see if I can get some more details.
okay.
Yeah,
thank you.
I have some separate confirmation on that, Rob, that I'll try and find and get to you.
Okay, perfect. All right. So anyone else with updates from the streets this week? All right. And just so you know, Richard, your hand is still up. I know you just commented, so I think you're covered. Bob, would you like to share an update with the group about what things are looking like on the Key Peninsula?
Sure. Cape Peninsula, the last 3.5 weeks, we got out 17 cases of water on the Key alone, but had trouble. Yeah, it all worked well. The water disappeared. We know who was getting it, but we had trouble walking into the areas where there are camps or small single and maybe 2-person camps. Because I'm old and not as fast as I used to be, and I ain't walking in there alone. So, but we're pleased, and for a lot of reasons. Tacoma Pierce County Health Department, as you all know, included the Key Peninsula as a community of focus. They are now taking the next steps, enhancing more services to be available to people to drop into the office at the Key Center. That's a big plus. And the providers around the area, Children's Home Society, food backpacks for kids, the fire department, everybody, Ben and Susan's, KP for Healthy Community are all in on this to make everybody aware of it and get people in there that need help. That's pretty much it. We are going to schedule an event, medical services event on the KP in the middle end of September. And Paul is going to work with us on that, as is TRM. And we may reach out certainly to Greater Lakes as well. They've been a great partner in the past, and it's time we get a regular program for that going. Real quick, Gig Harbor, just a lot more people in vehicles. And their police are finding them all over the city at night, usually not hassling them. But if they're downtown, they're going to be asked to move because there's concern there, and there's areas they shouldn't be parking. There are lots that are only for the people that use the marinas or live on their boats in the marinas. So a little extra traffic there. But the mayor is clued in. Garrett attended our call yesterday where Tracy talked a little bit about what's coming up. We have her ear. I think they're serious about trying to help us get some things done. The Gig Harbor Safe Parking operation opened up August 1st. We had 2 women in there. We now have 1 as one got ill. And the good news for that is that the church where the safe parking location is decided to help the woman who became ill, and the congregation member is now having them park at their residence and are caring for her. So just a wonderful outcome for that. So we'll keep moving that forward with Paula's great help. That's it.
Thank you for that update, Bob. And Patricia, I see you have your hand up.
Yeah, my brain's a little fried, so I'm just going to give you information. You can look for the details. There's like a new drug that people are smoking that's really creating some danger on the street. I can't remember the name of it. One of the benefits, though, but it's when you do go into outreach, you want to be very careful because there's like all these breaks and the violence and the sort of those tendencies. On a public health perspective, it is mitigating some of the wound care, but it's just to be aware when you do go into outreach that this does exist, and the patterns of behavior with drug use are not what we've what has been traditionally seen. So thank you.
Thank you for that heads up. So any last items for what folks are seeing on the streets? Lavada?
Yeah, good morning. I wanted to add to what the lady was saying about the drug that's out there. It comes in contact with the skin and it absorbs through the skin. And that's one of the dangers of it because the person don't know that it's happening until after the effect of it. So it's very important to not to be touching items or the person because sometimes they have it on their hand. And
Yeah, does
I don't know
anybody?
the name of it.
Janet,
Oh, okay.
I'll try to get that for you. I'm emailing it out because I saw the presentation yesterday and doing this stuff with I'm doing public health. So I'll try to get that to you as soon as I can.
Great. All right. So thank you for that, Lavada and Patricia. And it's always good to be sure that folks are being cautious while out interacting with folks who are on the streets, just like we'd be cautious with anyone. Appreciate the background information, and if anybody has further information to drop in the chat, that would be great. But let's move on with our agenda. So the next item on our agenda is our community spotlight, and I'd like to invite Dion from St. Vincent de Paul to tell us a little bit about all the work you're doing, Dion.
Hi. I'm excited to be here. I love this group. I think it's one of my most valuable resources. Can I share my screen? Am I able to?
I will allow you to here in just a moment.
I had a PowerPoint, but I can't get PowerPoint to work on my computer, of course, today for the first time. So I'm going to try to wing it.
Okay. And you do have the
see.
ability to share your screen. Yeah.
Thank you. I'm starting right now. I was actually in a group with a couple people who I talk to frequently, just a couple weeks ago, telling them like all the connections and all the things that I learned about how great this community is. I learned from this group actually when I started coming to this meeting. So I'm really happy to do this. So everybody knows St. Vincent de Paul is our thrift store. And, you know, we try to get the word out as much as we can that we are more than a thrift store. We have several different programs that I think would be valuable for everybody in this group to know about in particular. A lot of you know about our homelessness prevention and basic needs program, and that's kind of why I'm connected with most of you. But we also have our second chance employment program and our thrift store that provides in-kind goods to people in the community. So I'm just going to go into a little bit more detail about those things so you can understand all that we do instead of just, you know, the basics. The homeless prevention and basic needs program, obviously that's why I'm here. We help individuals and families struggling with their immediate basic needs, usually people who are having an emergency circumstance. And that means that most of our clients that we have here through the St. Vincent de Paul store or the St. Vincent de Paul helpline are experiencing homelessness. We try our hardest to get back to everybody quickly, but our response time is about 24 to 72 hours right now. Every client is treated with as much respect as we can offer. We try to take time to talk to them individually and understand their unique situation. And, you know, if we could do it faster, but why would we? Because we want to have that good touch and we want to make people feel like they're understood and heard. Our thrift store acts as kind of like the financial, you know, house for how we can do all these other great outreach programs. So people can access help through our thrift store. One of the great things that we do is in-kind resources. So it's the clothing, which everybody knows about, but we help with basic household goods. We have hygiene bags on site. We have, you know, beds, medical equipment, linens, and oftentimes tents and sleeping bags and things that people come in needing emergently. So we're serving the housed community as well as the unhoused community. Our second chance employment program is awesome. And I think that it's something more people should know about. So we do on-the-job training for people, and we partner with WorkSource, Career Path, Goodwill, and there's actually a couple other places that I couldn't name because that program is not mine. So I'm a little out of the loop on it, but we train more than 400 people a year through second chance employment. And the idea is to give them some skills to build on, to get to know them and understand what their goals are, and then to help them develop a good job history so that they can move on into the world, doing whatever it is they wish to do to be successful. One of the things that I love about our staff here is that most of our leadership and a lot of our employees have come from our second chance employment program, which means these are people who have lived experience with barriers, who have experienced, you know, all the complicated things that we need to understand as outreach. And so it kind of gives them a different feel for when people are walking into our store needing assistance. I see just any one of our employees, our retail employees, our yard employees, treating everybody with, you know, dignity and respect. And you can't have that without lived experience, I think. So it's a valuable program. We serve, like I said earlier, housed people and the unhoused, anybody experiencing an emergency circumstance. So most of our clientele are low income or no income, but occasionally people have emergencies and they need a little more assistance. We have, you know, housing crisis emergencies, we have house fires, we have, you know, traveling somewhere and getting stuck, things like that. We welcome anybody who needs assistance in any of those emergency circumstances to reach out to us. We do have an ID requirement, but I will say it's a pretty liberal ID requirement. So signage in our store says we need some kind of state issued ID, birth certificate, social security card, your health insurance card, your EBT card, your DOC ID, a letter from your caseworker telling me who you are. I have even asked somebody if I could look up their Facebook page because they didn't have ID. I mean, we just need to generally know that you are who you say you are, but we don't want this to be an incredible barrier because a lot of people who are unhoused do not have ID, and we do understand that. The only time that we need ID 100% is when we are vetting for motel vouchers, and I'll go into that detail a little bit later. There's actually not just us. We have 10 St. Vincent de Paul helplines throughout the county. So we have the helpline here at the store, and we have, you know, the walk-in outreach and the assistance email here at the store, but we also have 10 St. Vincent de Paul parishes throughout Pierce County that serve their neighbors immediately surrounding their area, and that includes the housed and unhoused that are staying in their area. So one thing that I always recommend is if you are wanting to refer somebody over to get assistance with rent or utilities, please go to our website, which is on this slide. It tells you where you can look up the zip codes, the helplines of the parishes, and see which of the helplines serve the area that your client in particular is in. A lot of times if they email or call me, I'm just going to send them to that helpline that serves their area, because while I would love to be able to serve everybody here, we are an outreach team of 2 here at the store. So we heavily rely on these other St. Vincent de Paul helplines to assist our community members as well. So, you know, I will put this information in the chat so that you guys know how to find information on what those other helplines are as well. For the quickest response, if you are referring somebody over to St. Vincent de Paul for assistance, I always say have them send an email to the email that's listed here. It is monitored by us here at the thrift store. It's the best way for us to get back to them. I think it's a lower barrier way because not everybody has consistent phone access, but a lot of people can access Wi-Fi. So if I'm trying to call people back and get information from them, sometimes it takes days for me to be able to reach them. Email seems to be the best way. And also, since it's a quicker process, it allows us to help them quicker than, say, them leaving a voicemail and us trying to answer it as quick as we can, which brings me to the helpline. You can refer people over to the helpline. If you are a provider that is referring somebody over for assistance and you want them to contact us by phone, please have them contact the helpline number. Do not have them call my cell phone. Because of the way that we have to handle self-referral, we need them to reach out to the assistance email or the helpline directly, not my cell phone. If they call my cell phone, I am just going to ask them to call the helpline or email. So if you want to do a direct provider referral, I would love for you to give me a call, text me at the number I have listed here, or send me an email. And that allows me to just check the box of direct provider referral, but clients directly need to be referred to the helpline. None of those things are faster aside from the email though. So, you know, email, like I said, best way to access services. We have some great programs in the work, and I'm really glad that Esmeralda introduced herself in the chat earlier, because Centro Rendu is an extension of King County St. Vincent de Paul, and they are setting up shop here. Esmeralda has been here the last couple days. They do specific outreach, which is to Latino families. They're providing education, social services, legal advocacy, lots of leadership development in classes, and catering specifically to the Spanish-speaking community to just address the barriers that they face specifically. So if you have questions about that, until we have some good stuff to send out your way, I would love for you to reach out to me. She's invaluable and wonderful, and it's been really great to connect with her these last couple days. Outreach at St. Vincent de Paul is changing just a little bit. We are hoping to soon open a community resource center. We kind of evaluated what we could do better as a trauma-informed organization. And one of the things that we came up with was, instead of having people walk through our store where people are shopping and sit in a general area, it would be really nice if we could have a more personal area for them to sit in, where it wasn't so public, where we could connect with them on more of an individual level. And I think the Community Resource Center will offer us the ability to do that. It will be here on site at the St. Vincent de Paul store. So nothing location-wise is going to change, but we will have a separate building for outreach, which, you know, I think will be better for everybody, including, you know, shoppers in the store. Another great perk of that is that we will be able to kind of create partnerships with other community organizations who might want to provide services or education services through that community center. So I look forward to reaching out to you guys, or you reaching out to me if you have any ideas about that. When that opens up, we're definitely going to be looking for ways that we can work together better as community partners. A little bit about the assistance that we've provided so far this year. From October, well, this is a little outdated, sorry. From October until now, it says we've helped over 15,000 people with more than $500,000 of assistance. And this program has grown so dramatically just since I've been here. I've been here for 2 years. We used to get about 15 calls a day, maybe 2 or 3 walk-ins. And now, as you can see at the bottom, we are serving 1,000 people more per month than we were at the same point last year. So we have experienced some substantial growth, which is part of the reason that we had to kind of refigure and think about that community center type of model instead of just the walk into the store and get your outreach. We have assisted mostly with rent, utilities, and motel vouchers. Right now, there's a huge community need for gas cards, which we do provide. There is an assistance cap for gas cards, which is once every 3 months. But as I mentioned earlier, we do have 10 different helplines in the area. And just because I assist somebody here through the store doesn't mean that they can't be assisted by one of our other partners. So if you're working with somebody who has already come to us for gas assistance or food assistance, and they still need further assistance, I would suggest that you look up our other community helplines and refer them out to one of those places so that our organization can continue to help them. Of course, we don't want to have a cap on how often we can serve, but you know, we can only be sustainable if we do. So if you have questions about that, let me know. Or if you need more specific resources for somebody in the area, please send me an email with questions. This is our impact for the year. It's been substantial. We help with vehicle repairs, tabs, driver's licenses, things like that. $134,000 so far. Food and gas vouchers have really, the need for that has really increased. So about $182,000, almost $140,000 in rent assistance, and then a pretty substantial amount of utility assistance as well. As I said earlier, the rent and utility assistance is mostly vetted through the other helplines that we have, not necessarily through the helpline here. But if you have somebody who is living in the area closest to the St. Vincent de Paul store, we would be the one that would serve them. You know, how can you help St. Vincent de Paul be successful? We're always looking for volunteers. We have a large amount of volunteers. We have a staff of 22. Anybody else you see here is a volunteer from one of our participating parishes or from the community. Shopping, you know, the thrift store keeps us open. So please think of us if you need to donate your household goods, or if you need to pick up a new, you know, couch. Boy, do we have a lot of them. We have a great event coming up, the Beyond Vintage auction and dinner, which I have not attended before, but I'm excited. All the staff here is chattering about how amazing it is. If you would like more information about that, you can look at our website. It's the banner at the top is just really promoting it, but it is a pretty unique event and I'm excited to experience it for the first time. So for more information, just check it out there. Oh my gosh, that was it. Was I able to do that all in less than 5 minutes? That's my question. I don't actually know.
Well, no, but it's all great information. So I really appreciate it. And so that we can move our agenda along, I did see at least one question, maybe a couple in the chat. If you have the ability to address those there, Dion, that would be great.
Absolutely, I will. And I'll copy and paste some information as well. It's always hard to slam that much info into 5 minutes, but yeah.
Oh yeah, for sure. And there was a request for the presentation too. So if you want to drop that into the chat, that'd be fantastic too.
Absolutely, I will do that. Thank you, everybody.
All right, thank you so much. And let's shift real quickly to the next item on our agenda, and that is Adam Reichenberger from the Tacoma Pierce County Health Department. Adam, you wanted to share something about a new role coming up at the health department.
Yeah, good morning, everyone. Hopefully I can help make up a little bit of time here. That was a wonderful presentation, Dion. Thank you. My name is Adam Reichenberger. I use he, him pronouns. You've probably recognized my face from these meetings before, but I am the Housing Policy Coordinator at Tacoma Pierce County Health Department. And I wanted to bring your attention to a new position we're going to be hiring for. It's going to be an environmental health homeless liaison. And it's part of the social, economic, and environmental conditions of health program that I am a part of. Should be posted today. I checked before this meeting and it wasn't up yet, but when it is posted, I will blast it out on the listserv so folks can see it. So I just wanted to describe a little bit about that position and see if anyone has questions that you can either, if it doesn't sound like we have time now, but maybe you can shoot me some questions by email. I'd be happy to talk to you about it. But there's two main priorities for this position. On the one hand, they're going to fill a role that's similar to Jenny Sheppy's role, who you've seen here. Her focus is on communicable disease control. So that's why you hear a lot from her about COVID and monkeypox. This position isn't going to be focused on that, but instead will focus on adverse environmental health events and preparedness. So think heat waves, cold snaps, flooding, wildfire smoke, water contamination, all the above, right? And helping to ensure that our public health response to these events meets the needs of folks experiencing homelessness and those working to support that community. So everyone in this room, right? They'll be working closely with me, probably with Jenny too, a lot of our community engagement team, the communities of focus that were referenced earlier. They'll all be kind of tied into all of that. The second primary goal of this position is going to support our internal response to the homelessness crisis. This is a relatively new and unfortunately, but obviously very late effort, kind of led by myself and Jenny and a few others to bring more accountability to the health department's support for folks experiencing homelessness. Some of you know, there's a number of us here at the health department whose work knowingly intersects with this community. But then there's a number of other health department folks, many of whom I haven't even met personally because it's a very large organization, but this isn't even on their radar, right? So when something comes up, they're just completely caught off guard by it. So again, Jenny and myself and a few others have been meeting to better align our own work and to try to understand not just the gaps in the services that we're providing, but also some of the barriers that we're putting up to accessing those services. One of the recent examples, just, things as simple as changing a graphic on some of our communications materials. And then it gets a lot more complex looking at, surface water and whose responsibility that is and how we're going to handle that. So it's an ongoing project, and this position will be the first position that is actually funded to support that work. So we're pretty excited to bring them on board. Yeah, if, like I said, the job will be posted, should be going up today, at which point I will, whenever it does get posted, I will send it out to the listserv. I certainly encourage folks to apply. Would love if you could share with your networks. We're pretty excited about this position. So hoping to get it filled soon so they can start the ground, or, start the work. But yeah, I don't know, Rob, if we have time, I can answer some questions now, or similar to Dion, I can look in the chat and try to fill in answers there if anyone has any questions. Also, I can put my email in the chat for folks to send me an email directly if they'd like.
Perfect. Yeah. Let's opt to have that correspondence in the chat, and if you could put your email in there, that'd be great. And really appreciate you giving us a heads up about the new role. All right, so moving right along, we wanted to carve out some time this morning for Caleb from the city of Tacoma to give us an update and share what's the newest with the city of Tacoma homelessness strategy update. So Caleb, the floor is yours.
Thanks, Rob. I appreciate that. I'm gonna make sure my screen is sharing properly before I move on and I get a thumbs up. Nice, Rob, thank you. Hello, Coalition. As many of you know, I am the Homeless Strategy Systems and Service Program Manager with Neighborhood and Community Services. Today's presentation will report on the homeless strategy that has been kind of in the works for the last several years. And we anticipate having a final document available for community to reference by next month. And this is really just based on all of the work that the city has been doing and some of the things that we continue to want to do to address the needs of people who are experiencing homelessness and the communities that are impacted. We talked about the strategy last, when I look back in presentations. I think we were with you last with the coalition in February of 2021. So it's been quite a while. And so my intention for this session is to loop you back in as a stakeholder to ensure alignment from the conversations that you previously had with my predecessors. During this presentation, I don't mind questions or clarifications from you. If you do raise your hand, I'll just be, as a reminder, we've carved out 20 minutes. And so for me, I hope to get through the entire presentation, but if I don't get to your questions, I will put my info in the chat and we can always discuss more at a later time. A few things before we get started. The strategy development has been in the works for about a 3-year time period. And over that time, several different individuals have contributed to this strategy, as well as collaboration with many different stakeholders, including the group that represents BIPOC populations, LGBTQI community, people with lived experience, other city department, regional funders, and community providers, and then also neighborhood and local businesses. I want to thank all of them for their work and contributions, including you all, to this strategy. Secondly, the strategy, it will always kind of be a living document, and it will be consistently assessing our goals and objectives during our performances and measurements and outcomes. I think the goals will always kind of be, and the values will be kind of central to what we do, but as we know, this is consistently always adapting and evolving, and we want to be able to make sure we're nimble to be able to do that. And then lastly, we are committed to transparency and accessibility for this strategy. Some feedback we have received has asked us to make sure information is accessible, easy to understand, and communicating our outcomes more effectively. So before I move on to the next slide, Mike, it looks like you have a question. And Mike, you're on mute.
Sorry, my phone glitched out.
No problem. Did you have a question?
No, I didn't.
Oh, okay.
I was checking the chat.
Oh, perfect. Okay. All right. So in a moment, the presentation will review some of their contribution documents that are directly influenced, and who has actually contributed to the strategy. Along with that, we will go over the mission, the vision of the strategy, what values we hold in developing the strategy, and the goals and objects that we have developed over time. And then lastly, I will present on what we're hoping to accomplish and how we know we have accomplished it. To understand the homeless strategy, it is important for us to be reminded of the supporting factors that give us a kind of strong foundation of this strategy. First, it's important to understand the declaration of the public health emergency on May 9th of 2017 relating to the conditions of the homeless encampment. The declaration was in response to the growing concentration of people living in encampments in Tacoma and gave us flexibility to establish emergency shelter quicker to respond to those emergencies. Secondly, the supporting partnership of anti-racist communities, known as SPARC, published a finding that people of color are disproportionately more likely than white people to experience homelessness, and the U.S. systemic discrimination and racism have resulted in disparities in ways in which homeless and housing services and programs impact diverse populations. One of these communities that SPARC study was, of course, Pierce County, Washington. Next, we also work within the context of the Affordable Housing Action Strategy. Affordable Housing Action Strategy, I think I said that correctly. And this is to connect our strategy to a citywide initiative to address our housing affordability crisis through 27 strategic actions defined by the city and stakeholders. And that website that's through the city is pretty extensive. And so if you're wondering what the city is doing around affordable housing, you can see some of the action plans that they've actually been working through and what phases they are in specific programs. Another important strategic response to note, though, is the Continuum of Care Committee, the COC. And this is in reference to what is also called the Road Home, who is broadly formed and conveyed to identify 5-year goals and strategies to address homelessness across the Pierce County and support the plan's implementation through the county's homeless crisis response system and beyond. Resolution 4622 is another highlighted for the strategy, which affirms the city's council dedication and commitment to comprehensive and sustaining transformation of all of the institutions, systems, policies, practices, and contracts impacted by systematic racism, with initial priority being given to policing in the city of Tacoma. And then lastly, the Pierce County Comprehensive Plan to End Homelessness helps guide the strategy in several ways to connect our strategies with the larger Pierce County plan. The plan design is to design systems to end homelessness. The single most important metric to assess this plan's effectiveness is whether the number of people experiencing homelessness is shrinking. So this plan is a departure from the prior plans of focusing on building a system focusing on building system scales to need, which is something that we're also trying to work on too. We mentioned earlier that with engaging our stakeholders to kind of shape the homeless strategy's vision and mission, and that's what we have here and drafted in those 2 critical focus points of the strategy. First, the vision here is the anchor point of any strategic plan. The vision outlines that what we want ultimately to be achieved and given purpose to the strategy itself. As you can see, we lay out our vision here where the people's responses systems address the needs of those experiencing homelessness while also supporting the needs of the residents and businesses. We want to not only create the environment to do this, but sustain efforts to support the work. Then you can see the mission here, and which is a general statement about how we will achieve our goals. This mission lays a framework of collaboration, finding solutions, and to address prevention, crisis response, and housing with the intentional language about how everyone's needs matter. Now we moved into the draft language about homeless strategy values. While our vision and mission talk about sustaining efforts, transforming those systems and everyone's needs, our values lead us into how we will factor equity and addressing racial disparities in this design. As you see, we lead with anti-racism, emphasize the needs of people living closest to the issue, and also the closest to the solutions. We're also looking towards trauma-informed care as a primary point of value, and we also use data to make decisions. Collaboration and capacity building are here again as one of our 5 values, and walking out these values means that we take time to make effort for authentic engagement, to include creating those critical feedback loops as we progress, which is something that we've been doing this week, including this time now. For our goals and objectives, we connect our visions and missions and how it takes form and becomes things that we can actually measure in action and effort. Goals identified here want to be, I think, as goals identify here, that we would want to address those three primary focuses areas of prevention, crisis response, and housing. And so we have developed these goals to encompass the needs of our entire community by transforming the systems to meet those needs. Under each of these goals, we are working on actions and performance measurements and metrics. And it is important that we mention here that our vision, mission, and values and goals were developed with input from the community, including individuals with lived experience. And the draft of this information has been shared to ensure consistency that what we have heard. I would like to mention that for goal 1 and 5, NCS has less control on about what we can actually implement, but we are part of the AHOS technical advisory group. And so with that, we have specific actions in that what we call that technical advisory group, but we also have influence to the AHOS plan. And so that is something that we're consistently trying to communicate about how to effectively help people be able to get into housing by the services that we offer. For goals 2 and 3 and 4, those surround access of shelter and services and creating more systems that we are trying to enhance, diversify, impact, and dignify all at the same time. For our objectives, this slide is a summary of each correlated goal and to help make this overall vision of a project. So again, for those goals 1 and 5, NCS does have a little bit less control, but for goal 2, 3, and 4, we have been actively working through these objectives. In response to the increase in awareness of needs, we would also look to add shelter options and capacities, as well as diversifying providers, including organizations that engage with our targeted populations. So one example would be 82nd Pacific with Monique, and our targeted populations being veterans. Setting up a mitigation site and a shelter for them was a priority for us. This action would also allow us to assess both the meaning of the need and effectiveness of shelters and services in individuals who are experiencing homelessness. As we are mostly responsible for the growing number, or mostly responding to the growing number of people who are unsheltered, we do look on how to build on the access to the continuum of tailored support to prevent and end homelessness, which is the reference why this is more of a living document, because we need to always be nimble and we always need to be able to address in our actions. Ultimately, having a strong prevention services and affordable housing are productive ways to keep people from becoming homeless. In order to achieve these goals and objectives laid out in the strategic plan, intentional focus needs to be given to developing the capacity and building out the ability for the city of Tacoma and our partners throughout the homeless ecosystem. NCS has been actively trying to fill in roles that will help us follow through on our strategy. We are in the process of interviewing for our management analysis too. Which I just want to give a special shout out to Jay, who is helping us on the coalition side to give input to be able to be on that panel to hire for this, so we can stay accountable for what we are hoping to do with the strategy plan. And this position will continue to help create and implement recommendations to develop and manage contract scopes of work, researching and developing performance measurements and metrics, and reporting processes and addressing contract compliance issues. Addressing homelessness is something that we cannot do by ourselves. We have to do this together as a community, and we are well aware of that. The city of Tacoma recognizes that the only pathway to address these issues outlined in the strategy is through our deep partnership and collaboration, especially with the organizations that we closely work with and the priority populations that we aim to serve. We currently participate with several regional collaborations, citywide initiatives and strategies, and regional partners. I prefer not to just list out all the things, but I'm sure you guys know we're involved in a lot of things, and hopefully are trying to implement those things with this strategy and our actual response to the people who are unsheltered. As you may know, that assessing those programs are extremely important for the work that we do and the impact that we try to have. And so programs are usually limited because those rely on referrals. They rely on they limit capacity. And so that's why we're looking about looking to transform to more systems so we can be effective and increase capacity building, allow for tailored experiences and responses. And we hope to build systems that address the most vulnerable population, such as those who have been chronically homeless, because those who are experiencing mental health and substance use disorder or who may need long-term supportive services are the ones that are the most impacted. And then hopefully as we're targeting those individuals, we'll also be able to meet the demands of the people that may not have those quite as high barriers. So that concludes my presentation, and I am ready for any questions or comments. Jan.
So let's see. Yeah, Jan, why don't you start?
And I'll read through some of the messages as well.
Yesterday afternoon at the Columbia Bank entrance in South Westgate, the 21st Street entrance to the parking lot, I saw a looked to be a 12-year-old boy panhandling. Now we know that folks who need to ask for money, beg for money, are not necessarily homeless, but there is a big intersection between the begging community and those who are experiencing homelessness. The fact that it was a child was horrific to me. A parent or guardian was sitting next to this child. So I called 311, hoping for some government response or intervention. 311 said, you have to understand that we don't have enough police to respond to even crime right now, so we can't send the police out, and we have no social workers. Call the non-emergent, City of Tacoma non-emergent 911, which I did. They said this does not warrant the attention of any of their mandates. Call 911. How can we interact with the city on child? I mean, to me, that's bordering on child prostitution when you see children out openly in the street corners begging for money. I didn't call 911. It is an incredibly sad state of affairs. So tell me what the city would have preferred that I do. Go to a particular social service agency, take the kid home with me. I mean, just give me an answer on what we can do.
Yeah, Jen. I think I think just even as you were talking and describing that is a difficult situation. And I think that what we have seen is that the systems in a lot of places have not been as effective as we really do want them to be. And there's no excuse to be able to have gaps in it that we can't respond to a 12-year-old boy. Or I'm sorry, a 12-year-old. I don't remember if you said a gender, but panhandling. On those types of things, the team, I think, including the HEAL team, are open to be able to be reached out to so that we can respond and reach out to our partners so that we can address and help anybody that's out in the street at any given time, whether it's a 12-year-old, whether it's, a male, single individuals, families, or whatever. Yeah, I don't necessarily have an answer for you right now, Jan, but I can follow up with you to talk about what I don't know and what I can look to see if find the solutions.
All right. So I have my hand up, Caleb. One question that I had is, so you said that you're expecting in the next month that the plan will be completed. Is the plan going to outline actions that will be taken as a result of this planning process? Because I think it's really valuable to plan and be intentional about how to use resources to have the biggest impact. But there's been a lot of planning, and it feels like the floodgates of folks being forced out of their housing and onto the streets have not slowed down the wait for the planning. So, so I'm curious, what actions do you expect to happen in response?
Yeah, a lot of this from the strategy planning that I've seen recent, that I've gone through and shift through, there are actions on there that we have already taken. And that's why I kind of have been leaning towards a live document of some of the actions that we'll continue to take and ones that we plan on continuing to use to respond. So a lot of them are past actions that we have taken that you're probably familiar with. So that will be included in that actual document, in that final document. On top of the actual document just being given, we also are trying to look at our website to be a little bit more fluid in representing the strategy too. So it's a little bit more interactive when you look to see what we're doing in terms of shelters or services, or some of the actions we hope to take. All of those things will be included in that. And I've been working with Media and Communication Office on how to have more of an effective website than just shelters and authorized encampment responses to that. So that is also part of our intention is to include. And that will give us a little bit more way of being nimble in our actions. Monique.
So many questions. So I guess you said that bullet number 1 you really didn't have much to do with in terms of the affordable housing. So I'm not going to ask you about that plan. I'll drop that question. Is there a plan, and I think there is, for more 24/7 shelters rather than, come get a bed and then we'll kick you out in the morning? And we're doing these low barrier shelters, but mental health is huge. And is there going to be some sort of support or more funding around the mental health aspect? Because I find that, especially for me, running an encampment with not enough knowledge on mental health, that is probably the biggest challenge. Not even the drugs and alcohol are bigger than, trying to help the folks with the serious mental health problems. So what are the thoughts around that from the city?
Yeah, so a couple of things I will address. The 1 in 5 goals, and I'll go back here since am I still sharing screen? No.
You're not right now, but you can reshare.
Thank you. Let me go back here, just so I have a reference point for you all. So goals 1 and 5, as I mentioned, are not necessarily something that we can always just control, but we have a lot of influence. And the reason I say that is because in order for us to be able to actually, for our systems to be able to be worth anything, we have to have a good prevention services, keeping people in their communities and in their homes, and also an affordable housing on the other end. And so if we're not in those conversations, then the things that we're doing is just throwing money at a problem, and it not having any solutions. So I know that a lot of you are saying, yeah, I think I saw some of you, unless we have long-term support, we're just throwing money into addressing, specific issues without actually long-term support. So that's why 1 and 5 are kind of in there, because we know that these are part of the goals in order for us to be effective with 2, 3, and 4. So I just wanted to mention that. I know we don't have control over that, but we do have influence, and it is one of the most important things in order for us to be successful. The mental health component, I know there's a history of under defunding mental health services in Washington State and the country and city for whatever reason. But what I do want to point out is that is a system that we are looking at, that it's not specifically a program that we're going to be able to implement and it will be super, super effective, because like I said, it's about capacity. But in every response that we are looking at, we are asking the question, how does this serve people who are experiencing mental health or substance use disorder, and how is this actually going to support them, or is this hurting them? And so and we get that feedback from you all about specific things, and we know that that's extremely important in all programs, shelters, services, whatever, however you want to. So that is one on the top of the ticket of the most important questions that we ask when we're starting to develop things. For 24-hour access, Monique, if you'd like to share maybe a little bit about your program in terms of 24-hour access. Do you accept intakes outside of particular hours?
Are you saying to come into the encampment?
Yeah, or into Fob Hope.
We typically do, you know, during the working hours. However, we have had our outreach, which was Tammy, you know, picking up people in the middle of the night and bringing them in. So we'll take them anytime. If we're not there, we just have them see security. However, we're completely full and have a standby list right now.
Yeah, right. And I say that because I think a lot of our emergency shelter sites are a lot more equipped to do 24-hour services than our congregant shelters, mostly because we have a lot more funding put into the actual staff to be able to do that. But again, you know, it's something that we're always considering and assessing on what the actual need is. This is, you know, at some point the resources kind of run to a point where you have to make hard decisions. And so we always want to make sure we're using our money, you know, our funding in the most effective way possible. But if they continues to be something that we need to respond to, we are always open to that conversation and feedback from you all.
You know, what concerns me, Caleb, and I'll cut it after this because I don't want to take up people's time. What concerns me is that in the county in general, and I don't know what it looks like for Tacoma proper, but there's 3,300 unsheltered individuals, and we're short 2,287 beds. And we're doing these tent encampments, you know, 25 here, 50 here, 25 here. I mean, is there a better solution so we can get more people inside than, you know, the smaller numbers?
So usually that response has been like congregate shelter, which we know that people on the streets aren't particularly fond of in a lot of cases. And we've even heard from this coalition when we talk about adding 50, it's quite a lot to manage.
Yes.
And so that's why we do smaller ones. And it's mostly because it's hard to find providers that are willing to do more than that anyway. I mean, there's very few that do want to, and we understand that. And so that's why we do a little bit of a smaller scale, and also on top of just available property in general. And that's kind of what we kind of butt up against a lot of times is really finding available property, available provider, and then the funding. The models are, you know, some of them are the flavor of the month and some of them are really good sustainable models. And so we just want to be really intentional about what we set up because we want to be effective. But really the goal is, you know, Monique, is I understand we have 3,300 folks, as you mentioned, but that's why we talk about housing be a sustainable model, because people aren't exiting the shelter systems fast enough in order to be effective. And we realize that. And so that's why without affordable housing, without mixed housing, without any more housing, we will just always constantly be running up against that.
Right. Okay. Thank you.
Yeah. Mike, it looks like you do have your hand up.
Yeah. So I was actually curious about who I can contact or work with, because I have a lot of housing that I've offered to, you know, a lot of nonprofits in the area, and a barrier that I'm running up against right now has to do with offering some of these super low income individuals storage. And I've just run into a lot of barriers with the city because I've been splitting up garages, which typically, you know, people who are renting a room, you know, they don't need to use the garage in a room rental situation. So I've converted some of those garages just to storage spaces, not any sort of crazy construction going on. But the very first house where I tried to create 7 storage units for all of the tenants in the house, I immediately got a stop work order. And it's been a huge headache to even try and get it passed, even though it's not a living space. And so who would be the best, or what would be the best way to, I don't know, tackle that? It's just another piece of the puzzle I found.
Yeah, that might be we can maybe talk a little offline and see if we can figure out a possibility. We run into, as I mentioned, for the emergency declaration back in 2017, it did allow us to kind of, in our own systems, to be able to bypass a lot of things like that. And so I do wonder when we stop that emergency declaration and I have to go back to more bureaucracy of just being in government. So let's talk through, Mike, I'll share my contact and the information, and let's see if we can point you in the right direction to get better solutions here for you so that you can keep people housed and keep people's stuff stored.
Okay, sounds good.
Yeah.
Separate from that, I just as far as success in going and sharing how to house these individuals, I have found that master leasing has been the ultimate and best way for me to get people housed. So yeah, that's just been the best for me as a landlord, to have another nonprofit fully take over a house and do a room rental with their case managers. And yeah, so.
Thanks, Mike, for
All
sharing.
right, so
yeah.
Caleb, we've got a few other folks with hands up. We're running over our time allotted. I wonder, why don't we get through these questions, and then any other questions, just if folks could put them in the chat, and then we'll see what we can do with this last hour, what's left of the hour of our meeting. So I think Patricia has her hand up first.
Yeah, and I had a lot to say. I'm going to try to go through this efficiently. Looking at the homeless strategy, I see like everything on paper looks great, but how is it going to be done? What are the specifics in that? It's questionable because we all want that. And then second, speaking in regards to Janice's perspective, that is what is going on. Like, I'm just going to say it. If we can stop gap where children think that are being desensitized to what sort of behaviors are out there and what sort of lifestyle ways there are and what sort of coping mechanisms there are, if we can stop gap that there with the children and the kids, even through like families and so forth, that is something that Tacoma can do within their sphere of influence. Because what I'm seeing and what I'm seeing on the street is that this is becoming, I'm going to just use the word, maybe not politically correct, normal, what they call not panhandling, but flying a sign, asking for monies, not creating life skills. In our schools, we can do this in Tacoma. In our schools, create life skills that create adulting, that maybe coping mechanisms can change so that people don't land in homelessness. I would like to see that part of the program. In regards to stopping, when you talk about the continuum, I'm just trying to pick up that piece, because what we're seeing is not, it's life skills and coping skills that have gone awry, and that I'm gonna just leave it at that, but I have a lot more to say. But please pick up the children piece, because it is the most heart-wrenching when you see this and the behaviors, and you see kids homelessness, you see a whole family within a small car. That is suffering. Thank you.
Thank you, Patricia. And Kathy. And you're muted.
Unmute. There we go. First of all, Caleb, I would just like to thank you for being willing to stand in the line of fire with this group. We're a lot of passionate people, service providers, government agencies, and we're going to have a lot of questions and we need answers. Right now, my largest frustration is with the metric that is being used for what is considered affordable housing. It's very frustrating to me. Are we talking 50% AMI, 80%? I'm going to be straight up honest with you. My number one concern is the people who have 0 to 30. And the reason why I'm telling you this is because a lot of the folks that have reached out to the Tacoma Tenants Union over the last 6 months since we've rebooted and been reactive are seniors who at the end of life, when their life should be easy, when they should be able to rest.
And it looks like you froze up, Kathy.
Am I talking? Can you hear me?
Well, I can hear you now, but you cut
Okay.
off.
Yeah, I have very spotty Wi-Fi in my apartment. I very much apologize for that. My concern right now is for the 0 to 30% AMI, especially the seniors, because they're on a fixed income. Their market rate activities are done, and they can no longer afford to participate with market rates, as we know, that have risen in figures are different, but we'll just say conservatively 22% in the last year. And those folks received a 5.9% increase. So that means that they're spending more and more of their money to remain housed and are having to bypass luxuries like prescriptions and food. My other biggest concern right now, though, has to do with safety. I've heard from a lot of female tenants who are seniors on fixed incomes who have gotten themselves into some very unsafe housing situations because they just don't have the income to, they end up in shared housing. That's great when you're in your 20s and you can put up with a lot of stuff from other people, but when you're a senior, you should. So my point of all of this is to just have you be aware that there is a gap of people that are being served, whatever they're on, Social Security, DS, whatever they're on. But I'm hearing from a lot of tenants, especially females, who are seniors, who are renting rooms at market rates, and they're just not safe. They're just not safe.
Thanks, Kathy.
So
thanks.
Be aware that is something that we need to focus our efforts on, because if we're talking about available and accessible, at TTU, I always say we need safe, affordable, and sustainable housing. So
Thanks, Kathy.
Courtney?
Yes, thank you. I'm curious, and then I have a couple things. I'm curious about what anti-racist lens looks like for the city. How is that applied? What's the praxis of that? But then I'm also wondering where the vacancy tax is, where expropriation of vacant properties are, whether it's vacant housing, vacant businesses, or just vacant lots. To say we don't have property or buildings available is wrong. We just don't have them in our hands yet, and the city can do that. So I want to see vacancy taxes and expropriation of properties and into social housing. I want a social developer, and I want real action and not words. Thanks.
Thanks,
Yeah.
Courtney.
Thanks, Courtney. A lot of those things too, as well as, I think a lot of people have passed on that same information and same concerns. And, it's something that we try to, advise as much as we can to counsel around policies and stuff like that too, as well. So we will always keep that on the forefront of trying to make available spaces as quick as possible.
And our last question comes from Nick.
Yes, I was wanting to know, Caleb, with the Hill team and what they do, I know they, go through encampments and, move people around. What is the strategy and action plan that you have set forth in the future for what they do as well? And I'm surprised that none of the members are not in the coalition meeting.
With the HEAL team specifically. So the HEAL team, yeah, my counterpart who manages that is Javon, and I help with the communication part because they are trying to do as much outreach as possible throughout the week. And so I'm trying to help as much with the communication component from the HEAL team as much as I can. One thing I would say though is that the HEAL team is always looking on systems. They want to be able to provide more outreach. And the outreach is actually tied with the shelter system pretty extensively, because if they have nothing to offer them in order to get them in a safe place or a safe situation, then they can't be that effective outside of the services. And so that's why it's on my end to make sure we're trying to provide as much shelter as available so that they actually have access to diversified shelter and not just one type or a specific type of bed. And in terms of systems that they are looking at, is one thing that we've been considering is maybe doing more of a calendar schedule. And so looking at a scheduling where we can invite other providers and other supportive individuals that can meet us in particular areas to continue to build rapport and systems so that we can address not only larger issues like mental health or health in general, but also niche too as well, because some communities have different types of needs, and we can partner with our outreach providers within our contracted, but also outside of our contracted, to be really effective at meeting the needs, the outreach needs of the community of people who are unsheltered. So that's some of the things that come up right now.
No,
Okay, and I did see Donald, you had your hand up.
Thank you so much. I'm sorry I haven't been here, but I've been going through some things. I wanted to, for those that know me, we've been running our program out of pocket for 8 years. We have a youth program and a house, but we haven't been able to open it up because we're coming out of pockets with everything. So we have the program, the written program, we have the house, but we just don't have the funds. Been doing gang prevention, the shootings and stuff like that. That's why I've really been busy. Youth programs that we've written, gang systems that we've written to get the young men that want to come out and can't. So that's the program that we've been working on is to stop the youth when they're in school, high school and so forth. They're trapped in between two things, the good and the bad. And so we give them that opportunity to come out. And I go into the gangs. I was raised up in Compton. I was a gang leader. And so I can talk to them. If I go in, the Bloods or the Crips, and the young man says, I'm in Pitchford's program, they leave them alone. And so we can, bring them in, education, work, ethics, and so we have those things, but we don't have the funds to do it. So, and the elderly, we have a house with older men that's come out, that served their country. So we have a house for them, and then we'll have a house for the younger men that come in, 30s, 40s, and then, like that. But, we're just hanging on doing that. So yes, that's the basic of it.
And Donald, we do have some, we just finished our mental health and substance use competitive process. We're just finishing that up, but we do expect to open our general competitive process here in the near future for 23-24 funding. And I'm not sure if you probably do know Vicki McLaurin, who oversees our community wellness and specifically those types of programs. So you're always more than welcome to reach out to her about how the city can support you.
Okay. Can anybody send me that information on email or what have you?
Yeah, I can definitely put it in the chat.
Thank you so much.
Yeah, no problem.
All right, thanks, Caleb. Carved out quite a chunk of time there, but I know there was a lot of interest, so appreciate your being here this morning, and appreciate everyone's participation. So I'm going to juggle things around here with our agenda a bit. And let's move to our government updates. I don't think, Caleb, you would have anything additional to add today from the city of Tacoma?
We do have one that I do just want to update you. I know I did say the MA2 position, but we do have a removal scheduled for Tacoma Screw, which is Center Street. I'm sorry, I was going to just bring it up, but I've lost it. But it will be, I believe, on Tuesday.
How long was that posted for? Usually you folks reach out to the coalition, so we have a little bit of time.
I think, I'm sorry, Rob, because I think this was posted on a day that I was gone. Let me see here. It will be posted. It will be posted on the 16th. So it hasn't been posted yet.
Oh, okay, great. If you could send me the information and the details in email, I'll make sure the full coalition mailing list receives that information.
I appreciate that.
All right. And as always, I gotta say, we don't support sweeps because, as Richard says here, there's where are people supposed to go? I sense they will probably go down the South Tacoma Way between 47th and 56th, where everyone else has gone. So that will be the next community meeting. Garrett, do you have updates from Pierce County Human Services?
Sure. I'm filling in for Jeff Rogers. I have 3 update announcements. The first one is that this year's Continuum of Care funding, so that typically funds ongoing permanent supportive housing programs, so rapid rehousing and permanent supportive housing. I guess I meant to say permanent housing. And that is due August, so applications are due August 31st. There's also an opportunity to apply for new programs. So really 3 programs: permanent supportive housing, rapid rehousing, and something called a joint transitional housing rapid rehousing program are all eligible. That doesn't really fund anything else. In addition, there is a supplemental Continuum of Care funding availability that's going to launch, I think, on the 15th. So that is going to be listed at that same page. And there's a link on that page that gives you email updates for when items get either added or updated to the county's continuum or the county's competitive bid process. So that includes Continuum of Care funding like this, as well as other funding. So those are 2 of the announcements. So again, and the new Continuum of Care, again, permanent housing, but that's going to be new programs. That has $5.1 million over a 3-year period with an expectation of continued funding. That's the supplemental. So that's $1.7 million a year. Again, to operate new rapid rehousing and new permanent supportive housing programs. So I think the permanent supportive housing can be used for some capital, like you have to have matching $1-to-1 dollars for capital, but typically we're using it for operations. The third announcement is, I was hoping to have more time and an announcement, and I have neither the time nor the announcement. So, but I did want to let you know the state Department of Commerce's public right-of-way funding that we have basically come to an agreement with Commerce and are really just working on finalizing that funding. So that's an initial $35 million. The bulk of that going into bulk of that ongoing purchase of a hotel, but then ongoing 10 million a year for operations of, and it's basically we're building a mixed shelter, rapid rehousing, permanent supportive housing model. And so that'll create about 265 to 290 additional, well, actually well over 300 additional shelter beds once all that's operational, and then probably about that many permanent housing exits to the private market, right? Rapid rehousing, scattered site, permanent supportive housing. But we'll have more details about all the different models we're using, and it's distributed across the county. I'm pretty excited about the items that providers put together. So happy to take questions on county things, and I'll try to answer.
Great, thank you, Garrett. And let's see, I don't see Valerie on the
Jan
call.
has a question there. No, Jan
Oh,
doesn't.
okay, go ahead, Jan.
Yes, I have a question. What about the contract, Human Services contract to manage inclement weather? Has that been awarded?
I do not believe that it's been awarded, but give me a couple minutes to look, and if it's, and I'll give you an update in chat.
Thanks, Garrett. Anyone else wanting to hit up Garrett with questions? All right, and you can do that in the chat because Garrett's good with those. Jenny, do you have any updates you would like to share for the Tacoma Pierce County Health Department?
Hi, good morning, everybody. Happy to be with you as always. Happy Friday. I'm going to keep my remarks short and focused on monkeypox. I've got a few slides to share that that Rob is going to help me with in just a moment. But we're working on resources to share, just constantly sort of updating things with monkeypox as it's a changing situation. But as of today, we have 13 cases in Pierce County. I've spoken before about this, and we'll share links where you can get more information, because I'm not a monkeypox expert, but monkeypox is spread through close physical contact with somebody who has the virus. So anyone can get monkeypox, but our resources right now are focused on communities where we are really seeing the most cases. So it's also important to note that unlike COVID-19, monkeypox is not easily spread through the air. You have to have very close personal contact with a person who is infected, or direct contact with objects like linens or surfaces that a person with the disease has used. If you suspect a case of monkeypox, encourage folks to see a healthcare provider. And please do so yourself and reach out to me if you have any questions. There is a vaccine strategy to protect folks from monkeypox, but demand for vaccine is high and supply from this so far from the CDC is limited. So our internal teams are working with DOH, with Department of Health on that strategy. Eligibility for the vaccine has recently been expanded. So I'd like to share that information today with folks here so that you can get the word out to others who might now be eligible. I'm working to next week have some additional resources for our shelter providers that would be more respectful of people's privacy to refer themselves for vaccine. But so far, I just have resources that you all can share as proxies with clients and guests if you're at a shelter, or others that you work with. So thanks, Rob, for sharing this slide. So this is where we are right now with eligibility for the monkeypox vaccine. So criteria were sort of expanded recently. So first and foremost, the vaccine is being prioritized for those who, a man who has sex with another man, so MSM, which includes born male. You know, you can see the explanation here of what that technical definition is for these purposes. And you must at least have one of the following sort of bulleted items. And you can see the first criteria is living houseless or unstably housed as a criteria. So we estimate that people fitting into this category are fairly low, but the data are self-report. So there are folks out there who are in need, who you work with or have contact with. So I would love for you to share this information with your staff, with others. And then the next slide, thanks, Rob, shows sort of what our current options are. One is that there is a vaccine clinic coming up. It's next week on Monday. It's in Lakewood, unfortunately, kind of out there, but there's a registration link there. We can share these slides out. Excuse me. The registration link basically shows the eligibility criteria that were on the previous slide, and vaccine is reserved for folks who fit in those criteria, within those criteria. The Rainbow Center, community partner Rainbow Center, is hosting events, and folks can call our call center at the health department to be connected with an appointment at one of those Rainbow Center events, or walk into a Rainbow Center clinic event. I forgot to put the address there, but I can get that out to you if you don't know it. Those events are upcoming on the 16th and 23rd. That's a less preferred option because there are going to be limited doses. I hate to tell people to go find a resource somewhere and have them turned away. So the third option is to call Axe Pharmacy to get an appointment. That's also not really centrally located, but that's another option right now. And then, as I said, things will be expanding, and we'll be getting some more information out and hopefully more opportunities for vaccine. Are there, and again, I'll share all the links like I typically do in the chat today for more information on monkeypox. And I also send out a Friday email. If you're not on that email list, please reach out to me, put your email in the chat, and I'll send that information out. Oh, and then before I open up to questions, I want to let folks know that, since I started doing this work, I've gotten information out to you all just from my email, from my work email. And the group, I maintain a contact list, and it's getting bigger and bigger because I try to add anybody who shows up at these meetings or that I meet through the shelter meetings and outreach teams meetings. I try to keep the list updated. So I'm going to start using a Gov delivery system for some important messages, maybe going out twice a month. And just what that means is if you've signed up for our health advisories or other communications from the health department, you've seen these emails there. They just have a banner and they're a little bit more formal and they come from the health department. And so the benefit here is going out to a big group of people. My email could be going to spam and things like that. So a more official email is likely to reach folks, and that will streamline some of our communications, and our environmental health team will be using that as well. So any questions for me?
Not currently seeing any hands shoot up.
Okay.
All right. Thank you. Thank you for that update, Jenny.
Thanks, everybody. I'll answer questions in chat. So if you have anything, just chat at me. Thanks all.
Yeah, and note that Courtney did ask a question in chat. Maybe you want to address that one.
Yep.
All right. So do you want to address that one verbally or just want to put it in the chat?
I'm on mute, sorry. The question is about gay men. I believe that all the cases are among men who have sex with men at this time. And that is, again, why the focus is on working with community partners that work in those with that community. Of course, like I said, anyone can get this. It just happens to be in that network right now, and it can jump networks just like other communicable diseases. But yes, I believe, don't quote me, but I believe that almost all, if not all, cases are in that community at this moment. So we're really concerned about that, obviously.
Great. Thank you for answering that. And I do see some additional questions flowing in the chat, so you can address those there. Thank you. So as you may have noticed, we have kind of blown today's agenda out of the water, and so we face a choice. Typically during these last few minutes of the meeting, we would do things like committee updates, and have an opportunity for comments for the good of the order, I would like to ask the group, would you prefer that we spend these last 19 minutes going over some of those basic items? Are there any critical updates that need to be shared? Or should we go to our breakout conversation and use the last bit of our time that way? So any thoughts? Anybody want to comment? Yeah, Rosemary.
I like the idea of being able to meet people a little bit, and any announcements could be put in the chat if we would look there to try to make sure we hear from people who had something important to say. I'd be up for that.
Oh, me too.
Okay. Okay, let's go ahead and do that. So what that means is, Timothy, would you like to go over the review from last week's breakout?
Yeah, I can do that, and I'll try to be quick with it to preserve our time for conversation. So last week we talked about how can we make it easier for the coalition. How can the coalition make it easier for advocacy voices to be heard? I broke the feedback on that into basically 4 categories: more public visibility for coalition perspectives, ideas for creating broader understanding of coalition advocacy and being more proactive, some possible issues that were identified for coalition advocacy, and ideas for broader coalition political engagement. So just to hit the highlights within those, in terms of public visibility, there was discussion of having stronger social media presence, more proactive social media outreach. This would, of course, imply coalition staffing and somebody actually doing that work. Something always to keep in mind when people have lots of bright ideas for what the coalition should be doing. Also, just more of a media strategy, more proactive media outreach, working that end of it. People talked about reclaiming the narrative on homelessness. Ideas for broader understanding of coalition advocacy. There was, some talk about doing some workshops around advocacy, some training around that. There was talk about, there seems to be some confusion and just lack of understanding about what the guidelines for advocacy and not around the coalition are. I don't know if there's a document that kind of defines that. Someplace people can look for clarity, but there's a desire for that. More coordination of messaging, of course, elevating people with lived experience, exploring the issues of organizing versus advocacy. I think that goes back to the training thing. And then just a call for more confrontational tactics, which I think goes back to that question of the role of the coalition and how we work together and understanding around that. Possible issues for coalition advocacy. People, of course, talked about hygiene, hydration, environmental health, things like that. Hostile architecture came up, more support for frontline workers, and more engagement around trauma, perhaps having some kind of a speaker on that or offering a workshop, something of that order. Ideas for coalition political engagement. Conveying the realities of the street to our electeds, another call within that for more aggressive tactics. People talked about doing voter registration as something that we can jointly do. and increasing our attendance at council meetings and things of that nature, and engaging in that. So those are the highlights, and there was a resource that came up for the Washington Housing Alliance that, you know, people follow them on Twitter and get their updates there, because that's just a great resource for folks.
Thank you, Timothy. And just so folks are aware, thanks for the kudos to the Washington Low Income Housing Alliance. I have invited Po Leapai from my coworker at the Alliance to come speak with us next week as one of our items on the agenda about a program called the LD Leads program. That's a legislative district leads program, and how people in Pierce County can be supportive of housing justice and ending homelessness and creating more affordable housing in the next legislative session. So Poe will give us a rundown on that next week. He was with us earlier in the meeting but had to go. So our topic that we wanted to talk about, LD Leads is what the program is called. And again, Poe will talk about that next week. So what we wanted to talk about for this week's breakout conversation is somewhat similar and plays off of the advocacy topic that we did last week. And that is some of us over the last week have been talking about the idea of creating some one-pager type documents that can be posted on the pchomeless.org website to give practical advice to people for what they can do, both to advocate, to respond to someone showing up with a tent on their block, or an RV on their block. Essentially provides information that people could use to actually engage with people who are on their block, and then also move towards solutions to the issues of homelessness we're seeing across the city and county, after we get past the requisite venting. And there's a lot of venting going on right now. The hope is to move folks toward supporting solutions. So what we wanted to ask for today's breakout conversation is, what do you think we should do one-pagers about? What would be the most critical information to share with fellow community members, businesses, and others to allow folks to move to compassionate action rather than just anger and venting? So we've got about 11 minutes left in the meeting. Why don't we spend about 10 minutes kind of brainstorming these ideas? If folks could take notes in your breakout rooms, I will send everybody off, and please gather your notes, paste them back here in the chat when you return, and away we go. We'll come back here at 10:59. All right, welcome back, everyone. I know we are at the end of our hour. I do hope that everyone will have an opportunity here to post your notes in the chat before you need to take off. It's so good when everybody comes back from the breakout rooms to see this sea of faces. I don't always see you on screen, so really appreciate that. So I do want to thank everyone for being at today's meeting. And look forward to seeing everyone again next week. As a reminder, again, we are aware there's some warm weather coming next week, so do watch the pchomeless.org website if it looks like we're going to see temperatures over 85 and need to do water distribution again. And thank you. I'm glad that you're all here. Glad that you're doing good work. And our community thanks you, even if we are frustrated that we can't end homelessness right at this moment. So keep doing good work, and we will see everyone next week. If you have the capacity to stay on the call, we're going to take a 5-minute break and then do some planning for next week's meeting. And have a good weekend, everyone.